Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. We're taking your calls at 866-870-5752 right here in the studio. Check out the website at www.lastemcells.com. And right now we are talking with Chris in Simi Valley.
Hey, Chris, Dr. Marc Darrow. Thank you for your call very much. So you're a vegan and you want to know why you gain weight. The reason is because you're eating carbohydrates. Okay? You're eating grain probably. You're probably eating dairy products. You're probably eating a lot of fruit.
Mm-hmm.
Okay, so those are all carbohydrates. Carbohydrates raise your insulin. When your insulin is up, you store fat. End of story. If you want to be a healthy vegan, then you cut out the carbohydrates like anybody else and you go on a ketogenic diet. That's protein, vegetables, and water or other liquids that don't have any sugar in them. So that's the answer to you, my friend. And
I'm also going to come to you. I've got a left knee problem as well. I've got an issue with some bone loss. So.
Okay. You have bone loss or cartilage loss?
Bone loss. I had an x-ray done about 3 weeks ago, and one of my orthopedic surgeons wants to do a total knee replacement on me. I said, no, it's not going to happen.
Can you walk
it's in the
around?
tibia plateau area.
Yeah. Can you walk around?
Yeah, I can, but it's very painful.
Okay. It's probably not from what you're thinking with bone loss. It's probably that you just need to regrow some of the tissue using platelets and or stem cells. I have to look at it, and if you bring your x-ray with me, I'd appreciate that.
I've heard some great things about PRP and prolotherapy and stem cell therapy, so I'm definitely into that.
Good. Well, I've heard a few good things about it, too. I'm being funny. It's all I do all day long. It's all I've been doing for the past 22 years or so. Yeah, it's got some great results. And, I'd love to see you, Chris. The office number is 800-300-9300.
I'm going to call and make an appointment. Come in and see you.
Thank you, Chris.
I appreciate that.
Thank you.
Thanks. God bless you, Chris.
Again, our number is 866-870-5752 right here in the studio, and we're going to go to Wilmer in Lake Elsinore.
Hey, Wilmer, Dr. Marc Darrow. I understand that you had neck surgery and you have issues with your elbow. Are they related, or is it two separate things?
Well, I think they were kind of related because I've had elbow issues in the past. I had a bursa sac on my right elbow kind of sticking out, and that's what I had on my left elbow. And then they go back to my neck, and the MRI showed my spinal cord was getting crushed by my vertebrae, and they call it myelomalacia. And then so they did a laminectomy where they snip off some of the vertebrae bones.
Yes.
And so it relieves the pressure on my spinal cord. Well,
that's a good thing.
Pardon?
That's a good thing to get that pressure off the spinal cord.
Yes. No, I immediately I could feel that my legs weren't as clumsy. I was falling down. It's been going on for about a year.
Yeah, that's a great surgery to do when you have to do it. No question about it.
Oh, okay, good. I mean, it's been April 6th was the surgery. I had my stitches out yesterday, but it feels
well, congratulations.
Really good. Thank you. But my elbows still hurt me quite a bit. I've tried all kinds of things, the ice and ointments and stuff, but I've been told I had. Is it mainly
the bursa that's the problem? The tip of your elbow?
Well, on the left one, yeah, it sticks out like a golf ball at times, and then it'll go inside, and my fingers go numb. And, you know, on my left hand, and like I said, that was the original thing I went in for, the orthopedics, to have that worked on somehow. But I had a steroid shot in my shoulder, and that seemed to really help. But I've listened to you before about the platelet thing, and I'm really curious if that would be beneficial for my elbows.
Well, it depends. The bursa on the olecranon bursa, the olecranon is that pointy part of the elbow when it's bent.
Right.
And that often, believe it or not, is a sort of a subclinical infection. And what I found, I know this is kind of strange, but I experimented with it because I read about it one time. Sometimes giving an antibiotic will get rid of that. And I've done that probably 10 times with people that have had it. Yeah. If you inject that, it often will make it blow up worse. So I'd have to actually physically see that and touch that and see what's going on with it. It's a very common thing. And you have to get an elbow pad that you can pick up at CVS or some drugstore or something like that.
Okay.
Because we bump our elbows all day long. And we don't realize it until something is wrong with it. Then when we bump it, we go, whoa, that hurts. So you need to get an elbow pad, number one. Yeah, number one, get the elbow pad. That we like to do conservative things first and see if it goes down right away. It might do the job.
Okay.
Okay?
That sounds good.
If not, give me a call at the office.
Okay. I've been using some stuff called Voltaren. It's an arthritis cream. It seems to be helping on my hands when my neck kind of went crazy.
Sure. Voltaren is an anti-inflammatory. It's a non-steroidal anti-inflammatory gel. So, that's all it is. It's not going to fix anything.
Okay, yeah, it's just a temporary thing. All right. Yeah. Well, that sounds good.
You're complex. I'd love to see if you want to come in. The number to the office is 800-300-9300. And for those of you who want to call in, the phones are starting to light up. So get in now. Call now. It's 866-870-5752 at the studio. I'll repeat that. Call me now. Talk to me now. 866-870-5752. I'd love to have your calls. Wilmer, you've got a lot of stuff going on there, and I'd like to actually be able to examine you and touch the areas and see what's going on. God bless you, Wilmer. We're going to go on to Alan.
In Culver City.
Hi, Dr. Darrow.
Alan, how are you today?
Hello?
We're here.
Yeah, I'm here.
Hi. I reached down about a couple weeks ago in between the bed and the wall with my left arm to pick something up, and it kind of got pinched in my arm got pinched in doing it, and I have pain from my wrist to my elbow in my arm.
Okay.
I wonder if you had any advice about that.
Are you getting better?
Not really. Not really.
I would have to actually touch the area to tell you what's going on. That's kind of a strange situation. It could be the ulnar nerve that was hit when you snuck it in between the wall and your bed, and that could make the whole arm feel pretty bad. It could just be something musculoskeletal, too. You could have sprained one of the muscles in the forearm. I just don't know the answer. I'd have to touch it to tell you. If you want to come into the office, just give a call at 800-300-9300. I'd love to see you and see what's up. Or you know what? You can go to the website. You go to the website if you like. That's www.lastemcells.com. Yeah, there's treatments. But write this down. The website is... Write this down, please, Alan. It's www.lastemcells.com, and you can... And there's a page... actually, there's a spot on every page where you can just email me, too, if you want to get more information. that we don't talk about today. Yeah, there's things that can be done. If it is the nerve, we can hydrodissect it. You can put a needle in there, and if it's impacted, you can kind of dissect away the tissue away from the nerve. But there's, I'm not going to tell you what it is over the radio. I don't have a clue. It's a very strange thing, what you're saying.
Yeah.
Thank you for your call, Alan.
I mean,
thank you, doctor.
We'll find out, Alan, but I can't do it over the radio. I apologize.
Okay. Thank you.
All right. God bless you, Alan. Good luck to you.
Absolutely. Well, we never know when we're going to hurt ourselves. It is what it is. So we have to be mindful, and that's a tough one. Our number here in the studio is 866-870-5752. That's 866-870-5752. The hour is flying by. I have lines open for you right now. Check out the website at www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on videos. And also, if you didn't hear us in the last few minutes, say that you get Dr. Darrow's latest book for free when you call the program today. The title is Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies. How about that?
I love it. Also, I wanted to mention that in the office we do something called the vampire facelift. I don't think you'll forget that. We inject stem cells or platelets into the face to regrow the collagen in the face, make you look young. Give yourself another chance. It's easy, simple to do.
And it's for men
and women,
right?
So I have a good question.
Right? Yeah? Okay.
Yeah.
Okay.
We get half men and half women that come in.
Cool.
I just got a nice question that came to me. It says, I have bone-on-bone in my left knee. That's bone-on-bone arthritis. A meniscus repair was done in 2007 that started the problem. Now, that's too bad that a surgery started the problem. And then had another partial meniscus repair a month ago. You didn't learn the first time. Keenly interested in stem cell therapy for the knee. I have an MRI and will be finishing a series of 5 Suparts injections, that's hyaluronic acid or a lubricant, in 2 weeks. They don't seem to be doing much help. And I'm going to explain why that is. I'm very, very active in my late 50s, also doing aggressive PT to strengthen and activate all the muscles around and behind the knee. Long-time runner, 15 miles per week, and have not run now since December. Well, the surgeries aren't going to help. You had 2 of them already. Stay away from that. The Suparts injections aren't going to help either. The hyaluronic acid, there's a lot of different names for it. Synvisc was one of the first ones many years ago. They lubricate the knee, but the problem is with a knee like yours, you've got fluid in the knee. You probably have hyaluronic acid in the knee already. Why stick more of it in there? You don't want that. You want to get that fluid out. I use an ultrasound when I treat, and I look inside, and I take all the fluid out, and with that same needle in there, I inject the stem cells or platelets. It's boom, boom, boom. It's quick. It's easy. It's simple. With knee, shoulder, hip injections, you've got to use an ultrasound to look inside. If you folks are getting injections in those joints without an ultrasound, studies show that 1/3 of those injections do not really even go into the joint. They go into the soft tissue. And if you get a Suparts injection into the soft tissue, there's a high probability that you're going to get a very allergic reaction and have to go under the knife to get what's called an incision and drainage to have it cleaned up. So
Ouch.
Be careful with that. I don't do those injections. I don't think they do a bit of good. Sometimes people say they help for a while, then later they come in and go, well, it worked for a while, it's not working anymore. But I've never seen them work, and not long term anyway. You want to fix it. How do you fix it? You regenerate the tissue, you grow it back, and you rejuvenate the joint, ligaments, tendons, whatever it is, anywhere from neck to back, all the joints, the shoulders, elbows, wrists, fingers, hips, knees, ankles, toes, bottom of the feet, plantar fasciitis. I even do quite a bit of TMJ work, temporomandibular joint dysfunction. A lot of dentists send me patients to fix that. That's pretty easy to fix. So
good to know. Okay. Do you want to talk to Joe in Los Angeles about his knees?
Joe, Dr. Marc Darrow, you were at my office and had your knees done. Okay. And your question is?
Good morning, doctor. Well, I was in to see you yesterday. I don't have a question.
Okay.
I just noticed that you've got a lot of people calling you about knees today. And
sure. Today's a good knee day.
I just wanted to say that a few years ago, I have Kaiser insurance, and I was at Kaiser, and they told me, I was having problems with my knees, and they told me that I needed knee replacements. I talked to a few people that had successful ones, but I talked to other people that had problems, and I didn't feel like playing like Las Vegas with my knees. So I came to
hear you.
You took care of me a few years ago. Now it's a few years later, and they started to bother me again, so I came back to you. I was there 2 weeks ago. You injected me, and the last 2 weeks I've seen great improvement, and I had them done again yesterday. They're a little stiff today, but
they're supposed to be,
I'm
Joe.
Sure,
yeah, that's normal.
Yeah, so I'm sure. Well, and I'm staying off them, but I'm
Good,
sure they're going to get a lot better. I just wanted to let these people know that it works great. I mean, maybe it doesn't work for it.
Well, I appreciate that. Yeah,
it sure worked for me.
Well, nothing works for everybody, and the biggest failure with doing regenerative medicine of platelets and stem cells is that people think it's a miracle, and they'll come in and get one treatment, and then they won't come back, or they'll go back to their orthopedic surgeon who says that's nonsense. It can't work, so they quit. It's like anything else. Rome wasn't built in a day, and your tissue doesn't grow back in a day. It takes a while.
It took me a few treatments, but it was well worth it.
Well, Joe, I appreciate that.
Much.
That's very kind of you to take your time to call in. Thank you so much, and God bless you.
Right on.
I'll be looking forward to seeing you in a couple of weeks and checking in.
Yeah, thanks again. I'll be talking to you in a couple of weeks. Okay.
All right, man.
Have a nice day.
Thank you so much.
Thanks for your call. Great.
Well, that was sweet.
That's very sweet.
Thanks, Joe.
And thoughtful. Our number here at the station is 866-870-5752. I have lines open, and there is a little bit of time left for you to get your call in. That's 866-870-5752. And check out the website at www.lastemcells.com. That's www.lastemcells.com. You'll get your free book when you phone the program. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Great title.
So, Nita, you have 1 second to answer this question. Are you ready?
I'm ready.
Why did the robber jump in the shower? Bzzz. He wanted a clean getaway.
That's a good one. That's a good one. Where are you getting all these? They're hilarious.
From my patients.
Oh, my God.
All we do is tell jokes all day long. Yeah, it is funny.
Okay.
So do you mind if I go to a hip question?
Go for it.
Yeah. Let me see what this person has to say.
Okay.
Okay, they say I'm 48 years old, was found to have osteoarthritis in my right hip 9 years ago. I've always played sports, always played through the pain and injuries, especially in my hip. Now the pain is severe enough to only let me play once a week. That's too bad. When I do play, I'm gimpy for 2 to 4 days. Bending down is extremely painful because of the intense pinching pain in the hip area. Adrenaline, Aleve, and ibuprofen and high pain tolerance is how I manage to still play. Yeah, that's true. When the adrenaline is high, which happens when we're doing sports, we don't feel the pain as much. Aleve and ibuprofen, I think, are not good things to do. They're anti-inflammatories. And studies show that when you take them, you end up actually with more joint destruction than if you don't take them. So I would counsel you to stay away from those on a regular basis. Once in a blue moon to take it when you're having a miserable day, yes. We treat hips every day, We treat shoulders every day, knees every day, necks and backs. And it's all pretty much the same business. I mean, it's really injecting the area with your own cells and stimulating that area to regrow tissue and to be rejuvenated. So I would love to see you if you want to come in the office. The number is 800-300-9300, and hopefully we can get you better. So it doesn't bother me that it's a hip and it has arthritis. It doesn't bother me that you have a lot of pain in it. I don't mean it doesn't bother me like I don't care. I do care, but it doesn't bother me in terms of being fearful that it can't be healed. Okay, we get people... Nita, you're breathing. That means you have a question.
Well, speaking of arthritis, we do have Mark holding on for you from Wilmington.
Well, let's do it. Hey, Mark. My name is Marc Darrow. How are you doing today?
Hi.
You've got arthritis in your ankle.
Thank you. Nice to talk with you.
You too.
I've been told I have arthritis in my right ankle,
Okay.
and it's almost consistent. It didn't used to be that way. I'm 67 years old and I'm still working.
Okay.
He gave me a couple options, the orthopedic doctor.
Okay.
Obviously, the
Yep.
worst one would be to having it fused.
Yeah, you don't want to do that.
No, I don't. And the other one, which is short term, is a cortisone shot.
Yeah, you don't want to
I
do
chose
that
not-
either.
I didn't want to do that. So he gave
Yeah.
me a shot of lubricant.
Yeah. We were talking about that a little earlier in the show, hyaluronic acid. It's not a fix-it. It doesn't do what you want it to do. And the other thing is when we do regenerative medicine on you using platelets or stem cells, the studies show that we actually stimulate hyaluronic acid to be produced. So why do something that is not going to fix it when you can do something that will fix it? So, yeah, I fix ankles all the time. We inject ankles all the time, even very advanced arthritis, and get people a lot better.
And that's what I was wanting to check on. If you have time for a secondary issue, I'll
go for it.
But if not, on that same right foot, I had a hairline fracture on my outside bone, which I think is the tibia, but I'm not sure. So we fixed that. He put me in a cast for 4 weeks and a boot for 5 weeks. And everything seemed to be working well with that. But afterwards, after I got back into my shoes, my left hip was starting to bother me, and the pain goes to my calf. So I went back to the orthopedic office and saw somebody that dealt with hips, and he concluded that after doing some exercise with me that it wasn't the hip, but it was the lower back that was giving me problems on that hip, and he thinks it's because my imbalance with the cast and the boot for almost 2 months irritated that somehow. And I do have lower back pain because that's the kind of work I do, a lot of lifting over the years. So I might have some arthritis in my lower back. But anyway, we elected to do a...
Oops,
Hey, Mark,
I'm
you're
so
going to have to
sorry.
call the office. You call the office at 800-300-9300. Let's talk more. And go to the website, which is www.lastemcells.com. You can email me from that, and we'll talk more about this. And
Thank
the rest
you,
of you
Dr.
callers, we'll talk to you next week. God bless you all.
Thank you,
Nita.
Alex. Thank you, Suzette. I'm Nita Valens. We'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.